Welcome to my Lecto. Today we are going to discuss arterial thrombosis. Thrombosis is basically a formation of the clot within the arteries. So it is called arterial thrombosis. So let's start. First of all, we will discuss the different layers of the arteries, and then we will discuss how thrombus form in the arteries. So here you can see that this is the different layers of the arteries. The outermost layer is this one. This layer, outermost layer is called the tunica externa. Tunica externa is the outermost layer of the artery. Next layer, which is the middle layer of the artery, is the tunica media. Middle layer is the tunica media, and the last layer, here you can see, the last layer include the tunica interna. Tunica interna, or you can say intima. So these are basically the three layers of the artery: externa, media, and interna. In the tunica interna, there are two different layers. First is the, here you can see that on the inner side, you will see this is the endothelial, or you can say this is the endothelium layer of the blood vessel, and above you will see that this is the subendothelium layer. So this is the most important component, endothelium, which is present innermost. Outside you will see the subendothelium, next media, and the externa. So these are basically the different layers of the arteries. But in normal situation, there you will see that the bore will be normal, and there is no contraction of the bore of the artery. But in abnormal situation, like there is a high level of the lipids, then what will happen? So here you can see this is the same layer. This is the tunica externa. Middle layer is the, which is the muscular layer, is the tunica media, and the last is the tunica interna. So in the you can see that the at the tunica media level, you will see that the lot of lipids deposit in the arteries. Lot of lipids deposit in the arteries beneath the subendothelium. So this situation is basically called, the atherosclerosis. This condition is called atherosclerosis. So first of all, we will discuss atherosclerosis. So athero means plaque, or you can say lipoid material. This is the plaque, and sclerosis mean hardening. So this is the sclerosis mean hardening. The hardening of the blood vessel, or you can say capillaries, due to the deposition of the lipoid material in the artery. So this is called the atherosclerosis. In that situation, you will see that lot of lipid deposit beneath the subendothelium, and when this lipoid material deposition continuously, lipids deposit continuously in the subendothelium layer beneath the subendothelium, then what will happen? Then the lipid deposit and a straight reach when the endothelial layer of the blood vessel rupture, endothelial layer and the subendothelial layer rupture, and you will see that if the endothelial layer rupture, then you will see that the collagen of the, so here you can see collagen of the subendothelium layer will expose to the blood side. So here you can see that actually this is the flow of the blood, and in that situation, when the collagen exposed to the blood, then what will happen? Then first of all, you will see that the lot of platelets adhere to the wall. So first step is the basically the different step. You will see first one is the adhesion of the platelets to the subendothelium wall. Next, when the platelets start adhesion, then what will happen? These platelets secrete different chemicals like ADP and attract more platelets to accumulate together. So in that situation, first layer, here you can see this is the first layer of the platelets, and next these platelets secrete different substances like ADP and attract different more platelets, more and more platelets deposit at the injured side. So in that situation, you will see that when platelets aggregate, then it is called, this process is the aggregation of the platelets at the injured side. Next, you will see when the platelets form a aggregation, then coagulation cascade start, in which you will see that the fibrinogen convert into the fibrin, and this fibrin form an enmesh entangled between these platelets and form a solidified clot, which is called the thrombus. So in that situation, after the aggregation, you will see the coagulation cascade. So first step, platelets adhere to the subendothelium. Next, these first layer, which is formed by the platelets, attract more platelets and form an aggregate. And when the aggregate form, then what will happen? Then the coagulation cascade start, and fibrinogen convert into the fibrin and form a clot, which is now called the thrombus. Thrombus formation. So in that situation, you see that atherosclerosis convert into the thrombus. So atherosclerosis causes the formation of the thrombus. So in that situation, you will see when the lipoid material break the endothelium, then what will happen? Collagen exposed to the blood, and in that situation clot start forming, and you will see ultimately formation of the thrombus. So this is the basic process, pathogenesis of the arterial thrombosis. So next we will discuss the basic difference between the thrombus and the embolus. So in that situation, thrombus is basically the formations of the clot at a specific location, at a localized position. So thrombus is basically localized. But if we talk about the embolus is delocalized. When this localized thrombus move to distinct part or and some other organ, then it causes the embolus. Then we call it is embolus. Embolus is basically the delocalized form of the clot. So this is the basic difference between the thrombus and embolus. Let's see, here you can see this is the structure of the heart. In that situation, let's suppose the thrombus form in the left ventricle. Then what will happen? It more chances that this thrombus moved through the blood in the aorta, and it can move in the descending aorta and deposit anywhere in the body. So the thrombus which is present in the ventricle, it is called thrombus. The clot which is present in the ventricle, it is called thrombus. When it move or dislocate the ventricle and deposit some other part of the body, then it is called the embolus. So this is basically the difference between the thrombus and the embolus. Next we will discuss the risk factor. What risk factor enhances the arterial thrombosis? So in that situation, first of all, you will see the family history. Positive family history. It means that arterial thrombosis formation chances increase in one family lineage. So next is the male gender. So male are relatively more affected by the arterial thrombosis. So next is the hyperlipidemia. hyperlipidemia. So in that situation, when the lipids content increase in the blood, then it is called hyperlipidemia. And you see, when the lipid content increase, then it causes atherosclerosis, and if atherosclerosis happens, then it convert into the thrombosis. So in that situation, hyperlipidemia is also cause of the formation of the thrombus. Next is the hypertension. Next is hypertension. In that situation, when the blood pressure increase, then it also causes the formation of the thrombosis. And next is the diabetes mellitus. Next is the diabetes mellitus. So diabetic patients has also increased risk of formation of the thrombosis. So, and next is the cancer. Cancer is another reason of the thrombosis or formation of the thrombus. Next is the smoking. Smoking is also increasing factors of the thrombosis. Next is the ECG. ECG abnormalities. When we do ECG, then you will see that lot of abnormalities. If there is an abnormalities in the ECG, heart is not pumping properly, then it causes also then the blood pressure vary, and in that situation ECG abnormalities can also cause the thrombosis, arterial thrombosis. Next is the lupus anticoagulant. Lupus anticoagulant. Lupus anticoagulants are basically the antibodies, and they also increase the risk of the formation of the thrombus. So next is the in case of inflammation. So if we talk about the inflammation, then inflammation, you will see inflammation, and you can see that in the inflammation different interleukin 6 increase, which is also the cause of the thrombosis. And you can see also when CRP, C-reactive protein, increase in the blood, it also causes the thrombosis. So basically CRP and you can say in the case of inflammation, you see that the risk factor of the thrombosis will also increase. So these are basically the different risk factors of the arterial thrombosis. So this is all about the arterial thrombosis. If you have any question, then you may ask in the comment section. Thank you.